do we do when medicine can prolong life but not improve it? And who gets to decide when it's time to stop?
So just like we're getting away from referring to diseases by the names of older gentlemen who came up with them, we are also in the same way in ethics trying to use descriptive language, trying to use words that mean what they sound like. But when a clinician decides that they need to invoke this concept of medically ineffective treatment, oftentimes it's because they cannot seem to reach a shared decision with the patient's decision makers.
I'm sure it's very difficult. It's probably hard on you as well.
I mean, first of all, I agree with you. It is hard. It's the misinformation and disinformation has been the hardest for me. As clinicians, like we're constantly interfacing with people suffering, right? Like it's everyone's worst. No one's having a good day when the person they love is in the ICU. It's not a good day.
Right.
Sometimes you have somebody who's 21 years old who's like carrying this huge burden for their parents.
Yeah.
You have sometimes parents who are bearing this burden for their adult children.
Like if there's a strong religious belief which is causing them not to withdraw care.
A lot of people, of course, believe in a miracle. They're hoping for a miracle. Some clinicians struggle a lot more with that language of a miracle and hope. We have an obligation as clinicians to not do things that we don't think they're not going to work. I think of the word comfort care, or the phrase comfort care a lot because it sounds so nice.
Yeah.
And it doesn't mean anything.
How does the legal system, kind of incorporate into the ethical decision making?
There are things that the law simply is silent on. There are things that the law doesn't talk about. The law seems pretty unethical sometimes. If you're a physician in Texas and you have a patient who shows up who's having a miscarriage, and your legal counsel is like, well, you're just going to have to let her bleed out in the parking lot until she's close enough to death that you can definitely say it's an emergency. I mean, that is absolutely unethical, and it is technically legal. One, I would say that if you're experiencing moral distress and moral injury, you're not broken. Because what we do is weird.
Yeah.
It's weird. Like being a healthcare worker is...
that. When it's over, I want to say all my life I was a bride, married to amazement. I was the bridegroom taking the world into my arms.